Good morning. Hope you guys have a great one. Today's kind of a special day because I'm actually filming what I'm going to be talking about. I'm going to be talking about the vaccine. I am actually taking the vaccine today, and I'm going to be telling you all about the vaccine, the side effects, who should take it, what happens to the body, what's the dosage. Now, I need to let you know that this vaccine will never give you COVID. It was produced by Pfizer and it was released for emergency use authorization on December 11th. And since I work in the emergency department of Blessings Hospital, I will be taking the vaccine today. Woo, let's get into it. Bismillah. Alright guys, so I'm in the hospital right now and they are taking the vaccine. All of us here will be taking the vaccine. So now I can't go any further because all of this is private information. But here's the vaccine and we will be taking it, so let's go. Hello everyone. So I just got done working in the ED. I got the vaccine. Honestly, there was nothing into it. Of course, I'm gonna be explaining everything here in a second once I get back to my office. But the only thing that I felt was the soreness at the injection site, which is pretty usual. And it's pretty common whether it's a flu shot or a COVID vaccination. You are gonna get a soreness at the injection site, but honestly, other than that, everything's fine. Hey, just made it back. Welcome back. This is Sulaiman Khani from Think Smart, and I just made it back from the hospital, and I'm in my small, nice office, and I'm gonna be talking to you about the whole process. What is the COVID vaccination? What are the side effects? Who should not take it? Alright, so the COVID vaccination is actually made of an mRNA particle that codes for the spiked COVID protein. And it's encapsulated in a nanoparticle just to allow easy and effective transfer to the body. Now I have to say that the vaccination will not give you COVID. Now, of course, the mRNA, which is a single-stranded RNA that is complementary to a DNA, will go through translation to code for the protein that causes the virus. What happens is that it activates different white blood cells. One of these blood cells is known as the T cells. These T cells that are developed in the bone marrow and activated in the thymus through a peptide hormone known as thymosin become active when they see the protein, the COVID protein. And so what happens is that since this is a viral and foreign protein to the body, it will present small part of this COVID protein to all nucleated cells in the body that have something known as the MHC. So basically what happens is that this small protein gets mounted into the normal cells, nucleated cells that have MHC1, and become like a flag. This small flag on the cell will then tell these T cells to come and actually attack this virus or this fake virus in the body. And so what happens, since these COVID proteins are mounted on some of these MHC cells, also known as the major histocompatibility 1 cells, class 1, T cells come in to attack this virus. These T cells will produce something known as the memory T cells, which is just a storage of all these T cells that are just ready to attack. Alright, so what are some of the side effects of this vaccination? It's like if you take a flu shot, you might get some headache, you might get some chills, you might get some fatigue within the first day, or weakness, but you also get that with just a normal flu shot or the influenza shot. And so a good recommendation is that when you take the shot, wait 15 minutes wherever you are, just to make sure that you do not have something known as the anaphylactic shock or a severe allergic reaction that can be like shortness of breath or chest pain. And those rarely happens. The only people that are prone to having an anaphylactic reaction are people that have had any sort of vaccination before, whether it's influenza or any types of vaccination, and had a severe allergic reaction. All types of other people, whatever ages after the age of 16, are totally fine to receive the vaccination. And so even people that have some medical conditions such as hypertension or factor V Leiden or diabetes are able to take the vaccination. Now, people that already have COVID or have been treated using other antibodies for the virus should ask their doctor first before taking the shot. This is for public use. Since we are in an emergency situation, it is very advised to take this vaccination because it will fight the infection when you actually get COVID. All right, so this vaccination actually comes in 2 dosages. And so when you take the first shot, you'll have to wait 3 weeks and then take another shot of the COVID vaccination. Now, you cannot miss the second dosage. If you take the first dosage, then you have to take the second dosage. The most common thing that happens when you take a shot, just like what I did today, is some muscle acheness at the site of the injection. Of course, this vaccination is taken through IM, which is an intramuscular injection, or just an injection to the muscle. All right, so I want you to like this video and comment below if you would like me to invite one of the doctors that I work with to talk in depth about this vaccination. Also, I will be putting down the links below to the FDA websites that talk specifically about the Pfizer BioNTech COVID-19 vaccination so that you can check it yourself and you can be comfortable with knowing all the needed and necessary information. Personally, I am very optimistic about this vaccination. It has a 95% effectivity. In other words, this can be 95% successful. I will keep you updated. Thank you so much for watching this video, and please don't forget to like, subscribe, and drop a comment below if you would like me to make another video of this kind. Stay blessed, and I will see you next week. Think Smart Nation.